Today, I'm going to talk specifically, give an example of a patient's story that I treated this patient a long time ago that did have pain with sex after having a baby. You may have heard us talk about the topic of dyspareunia, which is painful sex, and what can cause or contribute to the issue. Today, again, I'm going to talk specifically about a patient, we'll call her Jane, and where she was experiencing painful intercourse due to a perineal scar from her prior childbirth delivery. This patient, she delivered her second daughter 9 months prior to when I examined her. She reported that the pain with intercourse has been prevalent though since her first delivery, which was actually 2.5 years prior to that. So she's been having this pain for a while. She's been through 2 pregnancies and deliveries before her physician referred her and before she sought help for it. She delivered both daughters vaginally, of course, and she acquired a grade 2 perineal tear. And so second degree tears involve the skin and the mucosa of the perineum, as well as what we call the superficial perineal muscles around the vagina. So if I show you this pelvic model, which we love to show all of the time, just to orient you, this is a sit bone, another sit bone, anus, entry of the vagina. This is really hard to do backwards, urethra, and so on. The perineum is this area between the vaginal opening and the anal opening. And so when we have a grade 2 tear, it's tearing through kind of the vaginal mucosa and a little bit into the muscles, the superficial muscles around the vagina, not quite to the rectum. Those are a little bit more severe tears. So again, grade 2 is just a tear of that mucosa and of the superficial muscles there. When I examined her pelvic floor muscles, she had significant tethering. So she had a lot of restriction in that scar around that perineal body. So right, again, around here, she had a lot of tethering, a lot of tightness there, and a lot of pain, of course. And it was quite painful on palpation. So the tissue did not stretch because it was so scarred, resulting in a lot of pain, and especially with attempted penetration. I treated this patient for 10 sessions due to the severity of the scar and the high pain levels that she did have. But we're able to get her to tolerate intercourse with her husband again. We're able to get her to be absolutely pain-free. And in fact, she was actually able to regain desire again to have intercourse and pleasure with it too. Our treatment mainly focused on what we call manual therapy, or just kind of mobilizing or gently stretching that scar and the muscles around the area and the soft tissue. We instructed her as well and got her kind of doing some self-stretching at home. So put her in the driver's seat to mobilize the scar, get it to move a little bit better so she can get a feel for what the scar was like, and she can kind of control her pain levels as well. So again, we mainly focused on the manual therapy. We talked about lubricant use. In the meantime, after about 10 sessions, she got to where she was horribly painful to where she was absolutely pain-free. So really successful story. And this is just one example of the success that we see with pelvic rehab. We've treated many other women with similar presentations following a vaginal delivery, and all have had success with pelvic floor therapy. This particular case took a little bit longer to treat just because of the severity of it and the chronic nature, how long she's had the issue for. There have been other cases where some patients need 3 or 4 sessions of therapy and then they're better, they're good to go. And a lot of times it's a lot of education on how they can self-manage. There are many other conditions or diagnoses, of course, that we do treat, but this particular case is actually not uncommon. So if you know someone, if you are someone or you know someone that has a similar issue, please reach out, find a pelvic floor rehab therapist. Again, the condition is very, very treatable. We see it quite often.